It could have been avoided, and it all could have been stopped. That's what the family of a murder suspect says tonight after a deadly shooting.
Kenneth Beach is charged with the murder of his friend and the uncle to his children. The family believes if Beach received psychiatric help that day, he wouldn't have committed the crime. Good evening. I'm Emily Luxon.
I'm Rory Johnston. Thanks for being with us. Beach's family says he was diagnosed with bipolar disorder, schizophrenia, and depression. Our Kelsey Gibbs is following this for us. And Kelsey, I know you spoke with a mental health expert who says sadly this is just another example of a very broken mental health system.
Absolutely, Rory and Emily. Now, Dr. Keith Caruso says we need more money and resources when it comes to mental health. He believes if Beach had around-the-clock care and treatment, this could have possibly been avoided. Dr. Caruso says based on what he knows on Beach's mental illness and his criminal history, a facility should have admitted him. He tells me if a person is deemed dangerous after treatment, they should be placed in a mandatory outpatient care facility indefinitely. We do know that based on Kenneth Beach's criminal history, he was found not guilty on the reason of insanity for an attempted murder charge in 2004. After the court's decision, he was sent to a 90-day treatment facility, but Caruso believes Beach should have been in there much longer. Beach's family telling us the 39-year-old was diagnosed again with bipolar, schizophrenia, and depression. The family says Beach has been manic for 3 months. His wife took him to Vanderbilt University Medical Center on Monday, where they kept him overnight. On Wednesday, his mother tried to get him help at Centerstone, but because Beach said he was not a danger to himself, the family says the facility only scheduled him a follow-up appointment for the next day. We do know by that night he shot and killed his friend Jose Chirino. The family believes if he was admitted, this could again have been avoided.
But certainly, I think it's the limitation in resources. It's a limitation in the number of beds that are available. A lot of that is caused by, from what I know of the system, a shortage in nursing. We have more beds than are filled because you have to be able to staff those beds, and you have to have a certain ratio of staff to patients for it to be safe on the unit. So yeah, we could use a lot more money in mental health.
It will likely be up to a judge and/or jury to determine if Beach will either be competent to stand trial or find not guilty again on the reason of insanity. Emily.
Kelsey.